Hello and welcome once again to Ask Me Anything on Diabetes with me, Dr. Aniket Banvi. Well, we are glad that we have been receiving numerous amount of questions asking on diabetes and looking answers for what you're suffering from, or people who are being diabetic for many years and suffering from diabetes, or living a life being a diabetic, and we are glad to help you through this by answering your curious questions. And the questions have been pouring, and we have been trying to answer most of them, helping you understand most of the part through this live which we go on every Wednesday. Once again, we are glad that you are sending us those questions. Please keep sending those questions, those doubts which you have, so that we are able to help you in the best possible way. Well, so, what is the question? What is the today's question? The today's question is one of our patients has asked, saying that my HbA1c level is 8.2. What do I need to do to reduce this level? That is his first question. The follow-up question is that can I start to use sugar knocker? Help me in lowering it. If yes, tell how long will it take? Now, this is a I need to dissect this question. It's a long question, and I will, answer it chunk by chunk. So, first one, he's saying that he or she, I believe, is suffering from diabetes and is having a 8.2 HbA1c level, and I believe the person is suffering from type 2 diabetes, and that is why he has asked us primarily. And how can you reduce that level? So basically, our approach would be on three major planes or three major pillars. That would be on ahara. What kind of foods do you consume? How is your food habits is something that we will be looking into. That is the first one. Make sure that you also look into that. That is your ahara. What you eat is so significant, because it is said that the gut is the second brain, and what you feed is so important, because that is what is going to be reflected on your body, or not just the body, but the place which you've been provided or been assigned to live inside this body throughout your life. So whatever you're going to feed is something that you need to take care of, and that should be your first concern, and that is what will help you in managing it. That is the first pillar which we are talking about. The second pillar which you need to take care about is your lifestyle, the way you're living. Now, probably there might be certain things that has been not in your favor and are not helping you be healthy in this journey. So the way you're living right now is a consequence of you suffering from diabetes as well. That is how I would put it. So make sure that you check the routine, correct your lifestyle, the way you're living. Are you doing enough amount of physical activity? Are you regularly checking your micronutrients, that is vitamins and minerals level? Then making sure you are getting enough amount of sleep, proper amount of you know stress management. All these things combined together. How do you on among that? How do you take care? How has been the journey of you being diabetic? Have you been losing your muscle mass? That is also very important. Many a times when you don't have enough amount of muscle activated or muscle bulk, which helps in regulation of blood glucose level, that might be also leading. So there are many other things. The way you are living itself, from the time you have gotten up in the morning till the time you go to sleep, is so much important. And in between, whatever you do is the way you are living, and that is what you should be correcting. And if there is something that you're following wrong, then please do correct it. That is where ahara, and then comes the vihara, which we are talking about now. The third one is aushadhi. And as you have asked that can you start taking sugar knocker? Yes, that is when aushadhi we say that you can pick up sugar knocker and start the journey with us, as we handled you by providing a right amount of education on ahara and vihara also. So make sure that when you're starting, make sure you are not just depending on the medicine, but also correction of your lifestyle and correction of your food habits, and combined together, utilizing the sugar knocker at the best possible way will help you manage your diabetes. Now you have asked the very interesting question, how long will it take? So when we had inducted a research, and when we had done the studies to understand how significantly we can help people in this journey, when we were able to implement the ahara, vihara, and the aushadhi part, we were able to see the difference from somewhere between 3 months to 6 months. So in the span of 3 to 6 months, you will be able to see the results in your favor, and you will be able to manage your blood glucose level efficiently. And sometimes if a person is an insulin dependent, he is come down to dropping his insulin levels also. If you are on oral medication, you might be in a position where you have to drop your allopathy medicines also eventually, by correcting. And that is what the journey would be like, and that is how we will be guiding you. Now, to know more, please do visit our website knockdiabetes.com, because you will have all the understanding of it. Above that, if you want to get in touch with us, there is an consultation page on our website. You can book a consultation with me. I will sit down, I will study your case, I will answer your questions, and I will help you understand what should be done, what should be the next call to action to correct your diabetes, to help you manage your diabetes, is something that I'll be doing in the consultation, which is of 30 minutes. It's a paid consultation. You can opt for it to have a better understanding of your case and how can I help you in that journey. That also you can do. So make sure that you visit the website after you have watching this video, so that you will have a better understanding of what is the right actions that you should be taking forward. So I hope I've answered the question that you have asked us. And yeah, so make sure that there is something interesting that I had learned over a period of time when I was doing my bachelor's degree in naturopathy. uh, and the very first lesson they taught us is that body heals itself, and that was the very first principle. Now interestingly, it answered my question, it answered my curious question by the end of 5 years when I finished my medical school. And I understood that how are people able to be healthy by just staying with us, by consulting with us, by following the protocols that we are seeing or setting. It is just that we are helping or enabling people to create the right set of environment. And when you create the right set of environment, you're giving an absolute wide amount of scope in healing your own body. So when you provide your body with the right amount of ahara, vihara, and aushadhi, it is bound to be healed. It is bound to make sure that you are healthy and you function very normally. So make sure that you are in the journey of taking care of your health by correcting the environment around you, so that you can take care of your health and your body can heal. Now, also, what happens is that taking care needs assistance and help. Make sure that you opt for a right guidance, so that you will help yourself in the long term. Well, with that, I'll be finishing today's live session. Make sure you tune in on the next Wednesday at the same time around 7 p.m., where I'll come live and answer your curious question again. So if you have any doubts, or if you're wanting to understand something about diabetes, in and around diabetes, just type it in the comment section below, so that I can read them, I can pick them up, and I can bring here and I can talk and discuss about it. So with that, I'll take a leave. There are various other websites and web links. If you're curious to know more about us, get in touch with us more closely, please do check out the links which are available in the description, and make the maximum utilization of whatever is being provided from our end to help you in managing your health overall. So with that, I'll take a leave. See you. Have a great day ahead. Bye.